This recording is going to include the internal carotid arteries, the arterial supply to the brain, Circle of Willis, and the venous return. The right and left internal carotid arteries. Just like the external carotid arteries, the internal carotid arteries begin at the superior border of the thyroid cartilage. The internal carotid arteries will enter the skull by way of an opening in the temporal bone called the carotid canal or carotid foramen. The branches of the right and left internal carotid arteries are the right and left ophthalmic arteries. These are the first major branches, and they supply the eyes, both right and left, and their associated areas. Once the internal carotid arteries enter the skull by way of the carotid canal and the temporal bone, they will further subdivide into the right and left posterior communicating arteries, the right and left anterior cerebral arteries, and the right and left middle cerebral arteries. The terminal branches of the internal carotid arteries are the anterior and middle cerebral arteries. The right and left posterior communicating, the anterior cerebral, the middle cerebral arteries are the branches of the internal carotid arteries, and those arteries deal with the brain. Before we can talk about the blood supply to the brain, we must go back to the subclavian artery for a moment and list its branches. So the branches of the right and left subclavian arteries include the following: the right and left axillary artery, which we already did, and they extend toward the axilla. The right and left internal thoracic or mammary arteries, they're going to supply the anterior wall of the thoracic cavity or the breast. And the right and left vertebral arteries. These extend toward the brain, and these are the ones that we're going to be dealing with. So the brain. The brain is going to receive its blood supply by two means, or two routes: the right and left vertebral arteries and the right and left internal carotid artery. The right and left vertebral arteries branch off the subclavian arteries. They will pass through or go through the transverse foramina of the cervical vertebrae and enter the skull through the foramen magnum of the occipital bone. When the subclavian arteries reach the base of the brain, they are going to unite and form the basilar artery. This artery is a singular artery. The cerebral arterial circle, or the Circle of Willis. So what is this thing called the Circle of Willis? It's one of the most famous anastomosis. These vessels supply the brain. The arterial circle forms a ring around the pituitary gland, also known as the hypophysis, also known as the master gland. And as such, this means that there is a blockage in any one of these arteries. Blood can still flow and supply the brain and ensure that the blood flow is not compromised. The arterial circle is formed by 9 vessels. There is one anterior communicating artery, the right and left anterior cerebral arteries, which makes 2, right and left internal carotid arteries make another 2, right and left posterior communicating arteries for an additional 2, and the last 2 are the right and left posterior cerebral arteries. How are you going to remember this? Well, of course, Aunt Agatha. So Aunt Agatha itches for more pudding pie. A for the anterior communicating. The second A is for the anterior cerebral arteries. The I for the internal carotid arteries. P for posterior communicating arteries. And another P for the posterior cerebral. I know this seems like a lot, and it might seem a bit confusing, but don't panic. You're not going to have to. All you need to know is the arteries and where they branch from. Venous return from the brain. Veins that return blood from the brain are called sinuses or dural sinuses. So we're going to go through each one. Superior sagittal sinus is going to drain blood from the superior aspect of the brain. Inferior sagittal sinus will drain blood from the deeper structures or aspect of the brain. Blood from the inferior sagittal sinus will flow into the straight sinus. Superior sagittal sinus meets the straight sinus and will form the paired right and left transverse sinuses. Every vessel after the transverse sinuses is paired. From the right and left transverse sinus blood flows into the right and left sigmoid sinus, then into the right and left internal jugular vein, which will then flow into the right and left innominate veins, into the superior vena cava, and finally into the right atrium. You should look at the diagram that corresponds to this in your notes. The internal jugular vein and the subclavian vein are going to form the innominate vein. The right innominate vein and the left innominate vein will form the superior vena cava.